Welcome to The Aesthetic Edge by TIG Advertising. I'm your host, Tracy Shackelford, Marketing Director at TIG. Today I'm being joined by Yvonne, nurse practitioner and owner of the Renew Aesthetic Clinic, or Laser Clinic. Thank you so much for joining us today, Yvonne.
Thank you for inviting me. It's my pleasure.
Great. We're really excited to learn more about you and the Renew Aesthetic Laser Clinic. And we're just going to jump into it. What inspired you, Yvonne, to jump into the med spa space and run into the Renew Aesthetic Laser Clinic and really take that going forward? As a nurse practitioner, I imagine you have a lot of background, not only in the medical field, but also in the aesthetic field. So how did your journey begin in this space?
By 2017, I had a pretty long medical and nursing career. I was trained as a medical doctor in China and worked briefly as a physician in China in the 1980s. And then I came to the United States to do my graduate work in nursing field, and I had a couple of degrees in nursing in graduate school, both in Canada and in the US. And after that, actually, my first real job in the nursing world in North America was academic, was teaching faculty, teaching nursing programs. So that was about 10 years, a full-time career in teaching. And then I switched back to clinical work, became a nurse practitioner, and my field then was in the ER. So that went on for a while. When I turned early 40s, I decided it's time to do something different. ER was getting pretty challenging, and especially night shifts. So I decided to go into dermatology, but it was not cosmetic dermatology. I thought I was just going to general medical dermatology, and then I happened upon cosmetic dermatology clinic who's hiring nurse practitioners. That's how I got into aesthetic medicine.
Oh, wow.
So by 2017, I already had 10 years of experience because my aesthetic medicine career started 2007. And I felt like I was ready to open my own clinic with that experience, 10 years experience, working in a dermatology office, followed with in an oculoplastic surgeon's office, and then followed a medical spa, working for another medical spa. And I truly felt I was ready. That's one. Two, I find in the 10 years spent in aesthetic medicine, it was really fun. And the work itself is very rewarding. We're making people not only look better and actually make them feel better.
That's quite a journey, right? That's quite a path. So as a first generation immigrant and female entrepreneur, right? How has that impacted the values and the missions that you're doing within Renew Aesthetic Clinic? Like how has your background, aside from the nursing stuff, impacted the business that you're running?
I think when people go to our website, renewaestheticclinic.com, they see my face. They saw my name, my Chinese name of Yan. They already know probably I have a somewhat different background. And then if they dive a little bit deeper, I uploaded my resume online. They can see I'm probably first generation immigrant. I think a potential customer or client already feel something that they can relate to.
Sure.
They probably already assume I speak another language, which is true. I'm fluent
Yeah.
in Mandarin, and with Cantonese speaking population, Chinese population, we can write to each other.
Sure.
So they probably know I already carry another background, which is a little bit more beyond North America geographic. Probably my perspective is a little bit more global. They probably gonna already assume I traveled a little bit in my past. So all of that, I think your customer possibly already assessing yeah, there's something I might be able to relate to. So naturally ended up with more, you know, skin of color clients. So
Okay.
these are Asian immigrants. Obviously, they feel more relatable to me, and Hispanic population. Despite I don't speak a word of Spanish, I have clients coming in with apps as translators. They
Okay.
get by, you know. I have a couple of staff in the office. They're not fluent in Spanish, but they speak some. So that helps too. So
Great.
I think that just made the clinic open to all walks of life.
That's fabulous. That you are so open to basically all ethnicities, all skin types, all backgrounds and histories of people that come visit you for their aesthetic needs. That's wonderful. Along those lines, right? You guys emphasize a blend of medical expertise and artistic sensibility. How do you balance that in your treatment types for a natural and organic result for patients?
That's such a good question. When I think about this specialty, it requires not only a solid foundation that is based on medical science and your medical training, it is also very important to have that artistic eye. That artistic talent, sometimes it is very difficult to train.
Mm-hmm.
Um, it is very difficult to pass that sensitivity to another person. A
Sure.
lot of times when we hire staff, as a curator of the clinic, I felt like I am curating a group of uh, medical providers with very keen eye on beauty, right?
Mm-hmm.
And I'm also curator for devices as well. You're organizing your clinic around the beauty. So it is very important to have those two things: solid training, um, solid medical background, but also very much entrenched in beauty and art. And when I speak to art, not just art of a particular type, any background or exposure in art would help this work. There's visual art, performing arts, there are even some people pursue hobbies that's more beauty driven. So all of that gives you a sense of grounded in beauty. This is a world of beauty, a pursuit of beauty. So it is important to have that talent.
Absolutely. Very good. So along those lines, right, you guys offer a very comprehensive range of injectables, which I often consider the gateway procedure to drive people into the aesthetic space. Um, and having such a range of injectables, not only with just things like Botox, but also dermal fillers or Sculptra or Kybella, how do you determine what is the most suitable injectable treatment for individual clients?
That is such a good question, and it is a complicated question. I think the first important thing is get to know your client, right? You listen intently. Um, you have to consider what their expectations are. Although you have this very comprehensive menu, you have to customize to what your client needs and what they can financially afford.
Sure.
So, so that customizing is the key to success. So a lot of our work is based on meeting the expectation of that particular clientele at that moment in their life. So, although we have such an array of services from injectables to laser to esthetician services, now you have so much, but it's a very actually skillful, artful work to really listen to that client and figure out why they're here, what's their background in my field. Are they blank slate, have not done anything at all, versus a very sophisticated patient who's done a lot of invasive plus non-invasive procedures, has a mixed bag of happy experiences versus not so happy experiences.
Yeah.
And where do we fit in? So listen is probably the most important thing in my consult. I give them the floor. I let them talk. I let them fully disclose what they know, what they don't know. And if they are more on the spectrum or they don't know anything, then at that moment, education is a huge piece.
Yes.
Introducing, educating, sorting the misunderstanding out there. There's so many messaging and social media, internet, and they all do their homework. Believe me, before they came to my clinic, they've done a lot of, watching YouTubes and
Yes.
looking at other people. Family member had this treatment, that treatment, whether they're happy or not. They came in with a lot of preconceived notions, even though they have not done anything. So you just have to figure out where is your path. So listening, customizing, considering their financial resources, all of that, contribute to a treatment plan that's appropriate.
Okay. So along those lines of educating your customers, right? You have such a breadth of treatments that you offer. One includes a variety of laser treatments. Um, I mean, even behind you, you have a banner for Softwave, right? So, um, how do you stay on the forefront of available laser treatments and what you offer to your clients?
That's another very good question. It is a difficult task to stay at forefront of technology. This is a field that evolves very fast. Every year we have new breakthroughs. So how do you choose your devices? For instance, in 2018, after 1 year the clinic was established, that was a solid 1 year of just injectables. I have no cash to buy a device. So we have to inject into the laser world, so to speak. So the first device I picked up was LaserMD by Lutronic, a obscure, then at the time, 2018, South Korean company nobody knows about, a laser company. So the
Yeah.
big laser company in the US are Cynosure, Candela, Saitong. So
Mhm.
these are big names. I picked LaserMD. Now it's becoming more and more relevant and popular when I go to ASLMS, American Society for Laser Medicine and Surgery. Every year I'm a fellow there.
Mhm.
This is becoming the devices everybody's still talking about. But then my staff were all baffled. I came home with this and they're like, how do I market this? Nobody heard. Why don't you just buy an IPO?
Oh, wow.
So the thing about laser world is you have to be solid in your knowledge in laser physics. So I joined American Society for Laser Medicine Surgery back in 2008.
Okay.
I was lucky, situated in a cosmetic dermatology office. They sent me there, made me become a member. So go through that basic foundational training gives you the confidence. Although I'm an early adopter to certain devices, I'm full of confidence because I understand what this device will do. As far as marketing goes, I think if I can produce results, my patient will purchase. So whether, the brand has a name out there, I really didn't care. I cared about the core technology and potential efficacy and safety.
Great. Great. Okay, good. Um, Now, with things like how well a technology will work, I noticed that you guys offer things like MSculpt Neo and MCella. Um, what made you decide to go with those as non-invasive body contouring treatments?
There were, competitive technologies out there. By
Hmm.
and large, non-invasive body contouring technology, I view them in two groups, cold versus heat.
Yes.
You freezing those, fat cells to death, or you heat it up enough, you kill them, right?
Right.
So how do we choose? I chose M-Sculpt Neo, which is actually two technology combined. It is radio frequency RF, that's the heat,
Hmm.
combined with high FEM, which is high intensity magnetic technology that is contracting the muscle thousands of times in 30-minute span, which is going to build muscle mass and strengthening muscle. And when you have RF there to heat up the fat and kill it and body eliminate it, with the synergistic energy with the high FEM, you get the best result. So the clinical trial averaging in the trial population with NEO has lost 30% the fat and 25% muscle bulk. So how do we know? How does FDA giving these numbers on averaging results? They submitting clinical trial data, and when you have MRI slice the middle section of your tummy, you can see the layer of fat is 30% less. And your muscle bulk, your muscle layer is 25% more. You can measure it in whatever centimeters. You can measure that out. So those data are important when we choose devices. We have to look at what is FDA looking at, what kind of data from the clinical trial. So I read a lot, and I went to ASLMs every year. I've been actually chosen. You can sign up with each company. They go up to a hotel room. They put these devices on you. They do demo right there.
Sure.
So it is important to participate in this important conference and exhibit for was huge, like football size, because devices take up a lot of room, and they do these demos. So I would advise my colleagues, if you want to be informed and really want to experience firsthand new technology, and join ASLMs.
That's wonderful background. So thank you. Thank you so
Yeah.
much for sharing that. So you mentioned earlier that you and your esthetician staff try to customize the treatments as much as possible for your clientele when they come to visit you. You listen to them, the clientele as they come in. You talk to them. You educate them, and you do more than just the injectables or the machines and the technologies. How do you incorporate things like microdermabrasion or dermaplaning or chemical peels or facials into the repertoire of services? Like what does the customer journey look like once you understand what they're looking for? Do you start with the non-invasive stuff first, or do you go into the non-injectable things? Like how does that work for you guys?
The esthetician service is actually essential. The estheticians are trained in nurturing the skin, and they are very familiar with skin assessment, whether you're dry, you're oily, you're combined. Um, they assess hydration, and estheticians are trained with skincare products, which I am not an expert at all.
Sure.
So we call them, they're the expert of your lotions and potions and, the stuff you display in your beautiful waiting area, the jars,
Yeah.
and so that is important, because once you have the skincare products in place, the patient felt like they have some control on a daily basis,
Yeah.
whether that is preventing further sun damage, whether that is moisturizing their skin. So they are doing something in between the major treatments
Yeah.
to prevent certain things from happening, uh, to actually maintain their skin health. You put that power back in your patient or your client's hand. So they felt like on a daily basis, in the morning, they're doing something to maintaining the treatments you just gave them, cost thousands of dollars, or injectables or lasers. They are doing something for themselves. So that's where the estheticians play a huge role. And their services is much more affordable. It's not in the thousands. They're starting at 150, 200. And
Mhm.
you have more people entering that service feel they can also afford something, and they actually can help themselves at home. And a particular group of patients worth mentioning are women in reproductive years. If they're pregnant, if they're nursing a baby, they can't do any injectables, contraindicated. They can't do laser work, it's contraindicated. And you don't want to isolate that group of patients. Sometimes the pregnancy and nursing take a year, year and a half.
Yeah.
It doesn't mean they don't require skincare and help. And sometimes with a newborn, just get out of the house, come in and do a facial, getting pampered is
Yeah.
very, is very important for their psyche. And, just strengthen this skincare and talk to our estheticians is very helpful. They still felt like, yeah, now I have to pause my Botox or my fillers, my lasers, but I'm still part of Renew.
Great. That's good. I'm not gonna lie. I love the line experts in lotions and potions. I I'm gonna steal that. I hope you don't mind. Uh,
No, don't mind at all. Our estheticians love it too. And I joke with them when patients usually come in to see me, I'm holding a laser handpiece or I'm holding a needle. I'm hurting them somewhat, a little bit. But when they come in to see our estheticians, they get pampered. It's a different type of service,
yeah.
and one should have both. And it's like a string of pearls. uh, I said assistation service is like the thread, and the pearls are these big treatments. It's not a beautiful strand of pearl necklace without the thread.
Yeah. That's a great way of thinking about that. That's very insightful. So, beyond the treatments that we've talked about, you guys offer a breadth of wellness and holistic services, including PRP therapy, hormone balance treatments, even functional medicine. How do you incorporate those things and into your
That is a very challenging endeavor. We, fluctuate a little bit. I think our core services are injectable, laser, and assistance services, but occasionally people will request functional and wellness oriented. We try.
Mhm.
Uh, we're not always doing all of them. When I first started, I had paladin, hormonal, hormone replacement therapy for both men and women, very, very popular, very complex, demanded a lot of attention. And
Yeah.
we had to let that go because I got more involved in laser. Uh, so you only have so much energy as a medical spa owner and provider, and uh, developing your clinic in so many ways and training new people that are coming in. So I had to let that go. I gave that whole service to actually gynecologist. I
Oh,
poured
okay.
that whole group and transitioned. And lately, the GLP-1,
Yeah.
the weight loss medication, and it's really good for combination therapy for our
Sure.
MSCOP meal. Because when people start losing weight, and it's good for them to get to know our MSCOP meal. So we ended up offering GLP-1 because some people on the new in the new program want to lose weight at the same time. So it fluctuates a little bit, but we try.
Yeah.
There is demand for IV therapy in medical spa. We we are still on the fence. We're not offering that yet. So I guess what I'm saying is you have to look at your capacity and where you're comfortable, and
Hmm.
we try as comprehensive we can. But there are still things on the horizon we're considering.
Good. Very good. We'll get into those things in just a minute here, but I did want to highlight that Renew has been recognized with multiple awards, including the ASLMS Laser Excellence Award, the AMWC Finalist Awards. What do you attribute this recognition to, and how does it motivate your team to continue to be excellent in the services they're offering?
That is something probably from me personally. I was talking about earlier my background in medicine and more global. The AMWC award was actually in Monaco, in the little municipality um, close to France.
Yeah.
Um, so you first of all you have to know there is a possibility that you could submit a simple before and after photo, and a group of world experts. I don't know how many of them, but these are plastic surgeons, world renowned, and the cosmetic dermatologists. They're just looking at a lot of entries of before and after photos and don't know who did it. Basically, you submit these before and after photo. You tell them what did you do, in what frequency. In lasers, you tell them settings, and they'll review these before and after photo until they hit one. Say, oh, I like this one,
Sure.
and the highest the voting ones, and then they say, oh, Beaverton. Where is Beaverton, Oregon? Who is she? So in 2022, I said, I'm going to that conference. I'll just submit one or two and see what happens.
Yeah.
If we measure up, if work is good, great. That would really offers all the, nurses and nurse practitioners without MD after their name, to say it's possible your work could be, measure up. I ended up winning both the best energy-based treatment that year and the best non-surgical facial rejuvenation.
Wow.
So the best energy-based devices was only 5 people in the whole world in that category, and the non-surgical facial rejuvenation, 7 of us. So in front of my name says Miss Yan Duan. In 2023, I submitted another before and after. Again, it's non-surgical facial rejuvenation. They put doctor in front of my name
Oh, wow.
this time. I guess they dived into my resume, saw I was a trained physician in China, and this is an international organization.
Sure.
So I think it gives the team and the staff tremendous confidence to know you have a good leader. And anything is possible if you just mind your fundamentals. So
Yes.
what do I mean? My mantra to my team is fundamentals. What do I mean by that? I mean that by safety. If you're novice, you really need to pay attention to safety. The first rule in medicine is if you can't make it better, you better not make it worse, right? So that's safety. And once you progress a little bit, you're really chasing efficacy.
Mm-hmm.
You want results. After safety, you want both safety and results. And
Sure.
the last one is the most difficult. Not many people get there, is show efficacy with a before and after photo. With in mind, it's not just the lip. It's not just the cheek. It's a pan, face, neck, chest, and hands. I call these areas public space, right? People can see your face, your neck, your décolleté, and your hands. Don't forget your hands. It gets old too. And the first thing people say, oh, that hand is 10 years older, 20 years older than the face. So it's important to keep those areas in perspective. These are common areas people ask you to work on.
Right.
So that is important to keep in mind, and do not emphasize a particular feature, lip or cheek, and leave the rest of the face, behind. I
Right.
call them overemphasizing one area is never beautiful because that's your beauty sense. So when I review aesthetic work, I make it very simple to my patients. There are 2 things I'm doing. One is shape, that's contour. So when we talk about contour, this 3-dimensional work, I'm sculpting your face with certain tools, such as HA fillers. I know right now HA fillers are getting a bad rap. I still love it. When those fillers are in right hands, they are phenomenal. And they're quick. You get results quick. People know what they paid you for. But
Sure.
if you overemphasize one area, it looks out of place.
Yeah.
It's not good looking. We've seen all of that, too full of nasolabial fold. I often to my family, why do you want to feel that to such full degree? Because when you're born as a baby, you have those nasolabial fold. So
Yeah.
let's not change that. So let's bring the whole face up, look younger. So shape. The other thing is very important for patient to understand is superficial skin mask.
Yeah.
To change the mask is much harder work actually than contouring. So the problem with the superficial masks are complex, losing collagen, skin laxity, fine lines and wrinkles, discoloration, rosacea, acne scar. It goes on and on and on. And none of that is easy task. It takes time, takes a lot of combination of injectables and laser to get there. And the thread, don't forget the assistance services. So it is important to have that perspective. A balanced, harmonious, natural look is the goal. You
Mhm.
want to stay on top of the world to do this work. Yeah, they're not going to look at, the expert's not going to stop that. Oh, this is a great lip injection. No, that's not what they're interested. This is a great nose job. No, I think for non-invasive world, facial rejuvenation, they are really looking at pen face and neck.
Yeah, that's good. That's very good. Your passion comes through when you talk about these things. That's very refreshing. So, kind of wrapping up a little bit here. What's in the future for Renew Aesthetic and Laser Clinic? Where do you see yourself going? Are you getting new treatments or new technologies, or are you going to be expanding to more locations? What's in the future for you guys?
Yeah, it's been almost 8 years. By October, Renew will be 8 years old. We have two locations now. Started the first year or two, just solo. After COVID, we started hiring, expanding rather quickly from one device at LaserMD to more than 10 devices now.
Mhm.
Um, the impact is, I think, speak for itself, and the population of our clients are growing every day.
Mhm.
So where do we go? I don't know, to be honest. But I tell my staff, if you just mind your fundamentals,
Yeah,
what I said about safety, efficacy, able to show the world your efficacy, good things will follow. If
sure.
it grows, it grows. I'm not intent on grow, but if we get there, you know, we ran out of rooms. Basically, I had to expand into second locations. I have
Yeah,
nowhere to put my devices, and I can't have my providers doing procedures on top of each other. So if we get there, we'll get there. With the right messaging to the community, sensible advertising, responsible advertising,
yes.
uh, we'll get there naturally. I'm not pursuing anything. As far as technology goes, I'm always surveying new breakthroughs. I'm going to ASLMs every year. I'm serving on three to five committees each year for ASLMs. Yeah, so I'm on their CME advisories committee right now, and Women in Energy Based Devices committee, their silent auction committee, which is fun. I get to curate certain devices to put on auction, silent auction. So I think good things will follow you, you know, in terms of business growth. If you just solid mind your fundamentals, that's my everyday preaching to my team. Do good work. Good things will follow.
Good. Very good. So, okay, great. It has been wonderful talking with you, Yvonne. Thank you so much for sharing everything. How can people find you? Your website is renewaestheticclinic.com, right? You have two locations, one in Portland, one in Beaverton, Oregon. How else can people get a hold of you if they'd like to?
Um, the best, if you want to email me, it's yan at renewaestheticclinic.com. It's just my first name, YAN. Both locations on the website has phone number. Each office has a different phone number you can call. Our
Sure.
clinic front desk will take messages or get me if I'm available. So those are easy ways to get hold of me.
Excellent. Thank you so much. You are extremely passionate about what you do, and that comes through in every point of this conversation. So thank you so much for sharing all of that information. Again, thank you everyone for joining. My name is Tracy, and this has been The Aesthetic Edge by TIG.
Thank you for having me.